Hey everybody, the Digestion Doc here, Dr. Christine Kazmar, helping people regain their freedom from the crappiest, yes, crappiest, health conditions like Crohn's, colitis, IBS, and then some. What I'm going to talk to you about today are a little bit of more in-depth discussions about what I reviewed last week. If you didn't see last week's video, no problem. Just go into my channel that you're viewing right now and look at the last video. And I'll link it up below if it's possible with wherever you are watching this. So last week, I talked to you about different things. We talked about stress, we talked about the 10 organ systems, but if I'm going to go ahead and just review this with you one more time, it's really that how we restore normal function is 3 specific ways. To review, we need to remove the stress, we need to supply the body with the proper, adequate nutrition, and we need to remove the accumulated waste. We do those 3 things, we're golden. Really, we're golden, and that's how easy it can really be. So the next thing we discussed were these 10 organ systems: circulatory system, digestive system, endocrine system, immune system, and tegumentary system, the musculoskeletal system, nervous system, respiratory system, reproductive, and urinary. I don't know why I have my hand like that. And the urinary system. Please note that I have little stars next to the nervous system and the endocrine system because, as you will recall, when we go through that stress cascade, these are the 2 systems that are called upon to really initiate the fixit sequence. And if you didn't see that, so we have the brain, here we have the hypothalamus right in the center, really the master gland, and we have this sequence of 4 things that need to happen. The stress that comes into our body, whether it be from a structural or anatomical origin, or a physiological function or viscera or organ-oriented stress, or there's the emotional or the neurological stress. So those 3 stresses come into our body at any given time, or a combination of the 3, and that input those 10 organ systems have to handle. They have to deal with this incoming stress. But what happens is when these organ systems can't effectively deal with it, they now talk to mother, if you will, as I like to call her, the hypothalamus, and they're asking for help. And then what the hypothalamus then does is she surveys the scene, and now she calls upon the champion autonomic nervous system, as well as the endocrine or hormone system, and some might say even the enteric nervous system, which is your body's or your GI tract's second brain. I really feel we have 2 brains, the brain in our head and the brain in our gut, and that brain in the gut is the enteric nervous system. So suffice it to say, we're just going to talk about the 2 for now, which is the autonomic nervous system and the endocrine or hormone system. So hormone organs are going to be things like your hypothalamus, your pituitary, your thyroid, your parathyroid, your pancreas, your gonads. These are just some of the examples of the hormone organs that exist in the endocrine system, okay? Also, just a little bit of an insight. When organs that are endocrine in function, when they release a hormone, that hormone can take effect within milliseconds and or last long-term days and days and days inside the human body. Isn't that incredible? That a sequence can be lit up or initiated from an organ that's an endocrine organ, and its lasting effect can be days and days and days within the body. So crazy. Whereas the nervous system, it's an immediate response, right? If that person is healthy and that signaling, that transmission is where it should be, of course. So we've got the stress input coming from structure, function, emotion, right? We've got the 10 organ systems that are trying to deal with this. We've then got the hypothalamus coming in, mother, and she's like, okay, how do I fix this? And so she initiates the response to try to fix this and bring us back to that normal state, homeostasis, which is that natural healing rhythm. We want to be right straight up here. We don't want to be veering off here or veering off here. We don't want to be hyper or hypo, right? We want to be just sweet, just like Goldilocks, right? That's in that right spot. So now the hypothalamus is initiating those 2 sequences through the autonomic nervous system and through the hormone or endocrine system to try to correct matters. But what happens is if those 10 organ systems, or any one of them or a combination of the 10, can't properly fix themselves, that's going to lead to a muscle contraction. And so what I want to talk to you about today are the more in-depth symptoms that you might experience when this sequence goes all the way down to number 4, where that muscle contraction is now exhibited, where that area of the body can't do what it needs to do, where there's a tissue contraction, okay? So that's what I want to talk to you about a little bit today in more detail. So what then does happen when these organ systems can't respond to that incoming stress, or if that stress is coming in so frequently and it's not properly being handled, PS via adequate nutrition. Let's just start there because that's where we get energy to even heal or replenish the body. If the body or the organ, tissue, cell, whatever it is, can't respond, in this case we're talking about the organs, there's going to be a contraction. Okay? When you are in utero, day 21 in utero, 3 weeks in, your skin, organ, and muscle tissue forever communicates for the rest of your life. So when I'm talking about these muscle contractions, they're the pathway or the conduit, if you will, for me to find out what's lying underneath there. So there are more than 20 different digestive test points I check for in my practice if I have the advantage and the benefit and the pleasure to work with people one-on-one here in the office and in their physicality. I'm checking these different checkpoints or test points or stress points through muscle contractions. As an example, the universal stress point is right here, kind of like halfway in the middle of where your neck meets your shoulders, and then the last or more perimeter side here, or the edge. Go all the way in the middle and just feel right there with that belly of that muscle where it's kind of meaty. Press down in there, and if you notice that you have pain or significant tenderness there, that's the universal sign of stress. That means that your organ systems, or one of them or a combination of them, is already exhausted to a point. And one of the worst organs that takes the hit more than any other is your thyroid. Your thyroid takes the stress burden not only from the autonomic nervous system, which by the way is the sympathetic and the parasympathetic. Those are the two branches of the autonomic nervous system. You've got your sympathetic, which is the fight or flight response. Like if there is some kind of an axe murderer coming in here with a bloody knife and he's chasing after me, I'm gone, right? Like I'm like booking out of here as fast as I possibly can, right? That's your fight or flight response. But that's not what thankfully happens to most of us. Thankfully, we're not being chased by psychopaths. But instead what happens is we have the burdens of work and finances and relationships and all of those things. That puts us into that fight or flight response. And when you feel this point right here that's really sore, that's an example that you are exhibiting long-term chronic stress, that you've been in that fight or flight response for too long, or stuck or locked in that sympathetic response, which is driven by nutrition. Your autonomic nervous system is driven by nutrition. Your neurological system is driven by nutrition. Nutrition is the science of food. Food, fat, carb, protein, vitamins, minerals, and the very best of all, enzymes, okay? Any prescription drug that's out there, lisinopril or losartan or a statin drug or omeprazole, pick a medication. They are not foods. Therefore, they can't supply you with energy. They can't nourish you. They're not going to do a dang thing with modifying these organ systems and helping the hypothalamus initiate that fixit sequence. If nothing else, they are going to pollute the body. They're going to mess with your liver and your kidneys. They're going to mess with your blood tissue. And that's just something that we need to really think about. So back to what I was mentioning a moment ago. What if an organ can't respond? What then happens? Let's talk about that. So if there is an inadequate response, here are some of the things that you might find happening. A fatty acid deficiency, low blood glucose. Let me just stop right there and say something. When I give you those 4 inputs that I did last week, and I covered here briefly again today, where we have those stresses coming in from a structural, physical, or an emotional, or a physiological or functional or organ type stress. When we have an incoming stress, the next thing that really happens is your brain starts to ask, specifically the hypothalamus starts to ask, do I have enough sugar? Do I have enough glucose to get out of this situation? That's really what's happening. And so when the body is constantly under these demands, eventually what happens is there's less and less and less available glucose for the body because it's been so stressed for so long that you are impaired at your ability to heal and to recover and to get out of this stressful state. So when we're talking about inadequate responses, we've got fatty acid deficiency, we have low blood glucose, we also have in most people, sympathetic dominance. Like I was saying to you before, if I have like a psychopath chasing after me with a knife or whatever it is, that's a scary situation, but that's not what really happens. But the body doesn't know the difference between that and the stress of work, The body does not know the difference between a psychopath chasing you and that you're financially stressed out, or you're having relationships or breakups or going through divorce, or your kids are making you nuts. Listen to when I tell you this. Your body does not know what type of stress you're dealing with. It just thinks stress is stress. Your body does not know the difference between an emotional stress, a car accident type stress, or a functional or mineral or vitamin deficiency type stress. Think about that. So yes, we don't have people chasing us per se, but we have all this constant stuff happening to us where we are locked in and stuck in this sympathetic dominance. This is a alkaline deficiency, alkaline mineral deficiency. So what I am saying to you is, when you're not able to effectively get through this problem, because it's going on and you're not effectively addressing it, maybe you are chasing after symptoms and taking prescription meds, which are only going to make things much worse. This then is locking you into that further and further, and you are now dumping your alkaline minerals. Alkaline minerals such as potassium, magnesium, and sodium. You're going to lose these minerals, and these minerals have important functions. This is just the way it is, right? So you're going to be in that sympathetic dominance when you have these inadequate responses going on for too long. Next up, you may have issues with your pancreas, your pituitary gland, your thyroid. As I mentioned before, your thyroid takes the hit from stress coming from the autonomic nervous system as well as the endocrine system, so your hormone system. So the thyroid is like, if it's not healthy, it's going to start to exhibit symptoms. This could lead to either Hashimoto's or Graves' disease, okay? Going too fast or too slow. Going too slow or going too fast. The next thing is adrenal cortex. If this stress is still not properly addressed, this can now start to affect the mucosal lining of your GI tract. Every single one of these points that I'm talking to you about, when I test my patients in person or whether I do my urine panel, I'm evaluating what's going on with this area based on those muscle contractions. This is not me putting something in your hand and seeing if it goes weak. Although that may be interesting, that's not the testing that I utilize here. I'm literally feeling with my fingertips. They're specialized, these fingertips. I want you to know that I can feel under your clothing where I see this aberrant muscle, where it's contracted. And remember, that then links to an organ nearby. So I have 20 different digestive test points where I'm pressing and I'm looking to see what's going on, and I'm looking for those muscle contractions. These are signs that there are stresses, that there are these inputs that are going on that have not properly been dealt with. So what do you do? Okay, great, Dr. Christina, I hear what you're saying. This is nice, but what do I do? Well, what you do is you work with a doctor or a health practitioner who knows what's up, who embraces the body's inner doctor. This is something that I embrace fully. And you start to energize your body with food. How you do that is first you need to find out, what are you properly digesting? You need to find out, are you eating adequate amounts of your macros? Are you taking the proper amounts of supplements? Are you taking too many supplements? What supplements? All of this stuff is what I do. If this makes any amount of sense to you, and I hope it does, please leave a comment below. Let me know what you think, as well as if you are somebody that would like to work with me because this makes so much sense to you, or maybe you know somebody, all you have to do is call 586-685-2222 or check out longdistancedoc.com. This is Dr. Christine Kazmar, the Digestion Doc, helping people all over the world with Crohn's, colitis, nausea. You pick a symptom that's coming from the gut, and it's coming from the digestive system being in a state of stress, like all the things I just mentioned to you here. So thank you so much for tuning in. I really appreciate it. Leave me a comment below, and I'll see you next week for your next video. Thanks for watching.